The other thing that's going to happen is really high-performance networks, which is really the whole notion that networks have been in or out of network. But centers of excellence, many of you are familiar with heart, lung, those types of situations. There will be others that really begin to look at things such as domestic medical tourism, where people who have a particular high-tech need will end up going to a particular location in the country because they have the absolute best quality at the lowest cost. And then wellness is going to be a very important part of our business strategy. Where we are now is about segmentation, which is really a way of recognizing that not all health plan members have the same needs, want the same products in terms of life cycle and stage. Clinically, people, have pretty much the same needs for prevention, wellness, screening, etc. Consumerism is really a fundamental recognition that people are going to pay more for health care out of their own pocket. As a result, they are going to develop a much stronger interest in having the kinds of information that are available for most of us as consumers when we buy a host of products. People often confuse consumerism with high deductible health plans. It really is fundamentally about the fact that people are ultimately going to be more and more consumer-like. Not always. There are times you're only a patient, and there are times when you can be a consumer. Integration is really about this notion in our business of bringing the data and information together. It was mentioned, for example, our largest client is Bank of America. We handle all 350,000 employees. We provide the medical coverage, the dental coverage, the behavioral health coverage, the disability coverage, and we integrate the pharmacy coverage. And so a member calls one place, and if they are pregnant, they are screened for high-risk maternity. They may, in fact, have their disability case set up. And so everything that happens is happening in a much more integrated fashion, and we expect to see a lot more of that. And integration really speaks to how data and information is pulled together and used in the system. And it turns out we're the one place today in the system who has a much broader view of what's going on with a member than most other spots in the system. Now, we don't know everything clinically, but it turns out that claim data is a lot richer than most people think, particularly when supplemented with pharmacy data and the actual lab values from tests that the individual member has. I want to talk briefly about healthcare reform, which is a topic of great interest and is, I know, on everyone's mind. I think we've been pretty centrally focused on the whole question of how do we reform the healthcare system, not just the health financing or insurance system, which seems to be the locus of focus, but ultimately I can tell you our customers believe the underlying rate of increase in healthcare is unsustainable, and they are not going to pay for it long term. Their business models don't permit it, and they are going to figure out how to take actions to improve quality, reduce costs, and do so in a way that creates more value. And some of the things we think are important are getting and keeping everyone covered, improving quality, and making certain that we are doing the work to figure out how we provide better value in the system. I think the key elements of reform really focus around this transition from volume to value, really making wellness and health and prevention a priority, not just in the clinical setting, but also in the workplace setting. As more and more of our clients, for example, begin to have smoking and non-smoking rates. And the day will come when they'll have rates for people who are compliant with working to control their hypertension. They may not be able to control it, but they are working in the direction of doing that. So you can expect that wellness prevention screening is going to be an important component. Health IT is an extremely important component. Of our 35,000 employees, 20% of our staff are IT professionals. We are today a health information technology company. The other 20% turn out to be clinical staff engaged in care coordination and case management, disease management activities. The other things I just want to stress is as we look at reforming the system, what we're focusing our energies on is a recognition that the individual health insurance market is the market that works most poorly for individuals, and that the small group market is an area that also needs reform. For most large employers, the market has plenty of opportunity to create more value, but is not fundamentally broken as it is in the case of the individual market, small group. Now, when I meet with employers and actually elected officials, I ask them, would you be happy if the underlying rate of medical increase followed the shape of this line? And what this says is, we in year one, we started out at 8%. we got the medical cost increases down to 5%, 1%, and then actually took it negative. And people, the heads nod, yes, that looks like a pretty good cost rate of increase. And then I remind people that this is not a hypothetical line. This is a very real line. This is what actually happened in the rate of underlying medical increase costs in the U.S. between 1992 and 1995.